she has a coronary heart disease, and she also has a high cholesterol. All these four features are under the roof of metabolic syndrome, and she will present to generally physician with these problems. Now, if you Hello everyone, my name is Dr. KUNDAN and I am an infertility specialist as well as fertility enhancing endoscopic surgeon practicing at Nirmiti Clinic, Pune, Maharashtra, India. I am also a chairperson of Infertility Committee of Federation of Obstetric and Gynec Society of India. Today I am going to make you aware about polycystic ovarian syndrome, which is one of the very common problem in women's life and also one of the very common problem for getting infertility. So if you look at the definition first, PCOS is a medical condition where a woman suffers in every month anovulatory cycles, that is, she is not ovulating, and at the same time she has androgenic symptoms like acne or hirsutism. All those things can come under hyperandrogenemia. So after the definition, let us understand about the etiology. Now, if you look at the incidence especially of PCOS, we find it generally in a very high percentage in a reproductive age group women, because they come to doctors for the infertility problems more during this age. So this is a disease which starts right from the adolescent, and a girl who is adolescent girl who prone to have polycystic ovarian syndrome is usually familial. So generally it is the basic origin of PCOS is considered as an insulin resistance which runs in the family, and especially for those girls or women whose parents are diabetic, especially late onset diabetes, then their chances of having polycystic ovarian syndrome is very, very high. The second group or second most common etiology for getting PCOS is again a childhood obesity or high BMI into adolescent age group. So excessive fat deposition is one of the triggering factor for the onset of polycystic ovarian syndrome features in her life. So you have to understand that childhood obesity is something which we should not encourage to have it, and weight loss is very important in this stage. Now, generally, if you look at what age group a PCOS patient is presenting, and the symptoms also varies according to that. So, if adolescent girls comes to you with PCOS, generally they will come to you for two important problems. One is irregular menses, and second is sometimes because of the irregularity and prolonged amenorrhea, they usually get a heavy menstrual blood loss, and that is what is named as menorrhagia. Then if a PCOS woman comes into reproductive age group, so she will come to doctor with the symptoms of that she is not able to conceive naturally because she's got anovulatory cycles. This is the most common feature of reproductive age group, but sometimes even these age group women, they do come to you for signs of hyperandrogenemia. That is, she has a multiple acne, she has a multiple thick hair growth on the mustache area or the chin area or in the central part of the body. So these are all signs of hyperandrogenemia, and then there is definitely a cosmetic disturbance, and for that reason they come to the doctor to seek our advice. When it comes to premenopausal or menopausal lady, a PCOS woman generally comes to you for a metabolic syndrome, which is other systems are affected, like she has a diabetes, she has a hypertension, she has a coronary heart disease, and she also has a high cholesterol. All these four features are under the roof of metabolic syndrome, and she will present to generally physician with these problems. Now, if you come to a diagnosis, I think PCOS diagnosis is nowadays we do it by the Rotterdam criteria, where we see a polycystic ovarian pattern on the transvaginal sonography, and there is a documentation of anovulatory cycles, that is irregular menses, that is late menses, or there are signs of hyperandrogenemia. But when it comes to adolescent, this polycystic ovarian pattern in adolescent age group on sonography is not considered as a diagnostic criteria. So only irregular menses and hyperandrogenemia signs are the most important for the diagnosis. But in a reproductive age group, generally any two of these criteria are present, then it is considered as a PCOS. Now, if you talk about management quickly, if a woman present to you in an adolescent age group for irregular menses, oral contraceptive pills are considered as a best for a menstrual regulation. But the only limitation with this is that they can be given only for a short time, or even if you give it for a year or so, generally they will only ovulate after you cease this treatment. They will ovulate for a few months and again they go back to the anovulatory cycle. So as such, for a PCOS in adolescent age group, oral contraceptive pills is not very effective. Only for a short menstrual regulation it is viable. But yes, if you diagnose insulin resistance into these young girls, I think that's a right age to start drugs like metformin, so that you reduce insulin resistance by the time she reaches to reproductive age group. In a reproductive age group, when they come to you for infertility problems, then ovulation induction with the drugs like letrozole or using gonadotropins are the best and the topmost therapies, which gives you maximum clinical pregnancy rate in this age group to achieve the pregnancy. Now, a PCOS woman, when we treat for ovulation induction, remember maximum ovulation induction with these ovulations are allowed only for maximum 3 cycles. If during these 3 cycles, if they regularly ovulate but still they don't get pregnant, you stop. You stop and reevaluate and find out what are the other reasons for failure. And if you find out or come across any of these failures which needs or mandate to undergo IVF, it's better to shift them into IVF. So don't keep on trying after the 3 failed IUI cycles or ovulation induction cycles. So that is a very important part. Another very risk factor or a complication of ovulation induction in this patient is a ovarian hyperstimulation. So mild and softer ovulation induction protocols with only oral drugs like letrozole is the first choice, followed by, if she doesn't still conceive in 2 cycles, it's better to shift them with letrozole along with human menopausal gonadotropins injections, so that she develops 2 to 3 follicles and her chances of pregnancy rise almost 4 to 5 times if you combine also with IUI. So these are the best way of line of treatment. Now, when it comes to IVF treatment in reproductive age group, we have to keep it in mind that when they have to undergo IVF, better to freeze all the embryos in the first cycle, because you can avoid ovarian hyperstimulation risk by using GnRH agonist trigger, and you can transfer these frozen embryos in a later month when you have prepared her endometrium by exogenous estrogen. So IVF, when it comes to IVF, remember for PCOS, you have to do frozen embryo transfer. It will give you maximum cumulative pregnancy rate. The third age group where they present to you with a metabolic syndrome, then you diagnose those all diabetes, hypertension, and involve physician into the management, where you will start the therapy to lower their cholesterol, antihypertensive therapy, maybe some anticoagulants for coronary artery disease, or anti-diabetic therapy for a diabetes. So metabolic syndrome is something which we have to keep it in mind. Remember, PCOS patients are high risk to develop gestational diabetes during pregnancy. If anybody develops gestational diabetes in pregnancy, remember her chances of getting actual diabetes in a later life is very, very high. So dear friends, a PCOS life or a woman's life starts from adolescence, and it affects her in her all important stages of lifespan. So if we take a right step at the adolescent stage, where you control the weight, where you diagnose insulin resistance and control insulin resistance, there will be a certain percentage of chances that you will prevent further complications in her life. So this was my few introduction points for polycystic ovarian syndrome. I hope that you will attempt and reduce weight or ask the patients to reduce weight, so that they maintain the steady weight in their life, so that exacerbation of all the features of polycystic ovarian syndrome can be reduced. So thank you very much for the patient hearing. Thanks a lot.